Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. For this video, what I want to talk about is patella or kneecap mobilizations after knee replacement surgery. So your patella is what's called a sesamoid bone, and what this means is it doesn't attach directly to any muscles or tendons. It actually lays right underneath your quadricep tendon that is attached to the big quadricep muscles of your thigh. And the purpose of the patella, or your kneecap, is it acts as a pulley system. So when you go to straighten your knee, the quadricep tendon will pull over the kneecap, and you'll be able to straighten your knee with a lot more ease than if the kneecap wasn't there in the first place. Now, what happens after surgery sometimes is the kneecap can get very stiff due to swelling, inflammation, or scar tissue. And we want the kneecap to be mobile and able to move freely. And the reason for this is for different movements, your kneecap is actually going to move some. So for example, when you straighten your kneecap moves a little bit superiorly or towards your head. When you bend your knee, your kneecap is actually going to move a little bit inferiorly or towards your feet. So we want to be able to have that free motion of the kneecap. And if we're able to improve that mobility, what can happen is it will improve the amount of range of motion you can have, and it can possibly improve the ease of performing different range of motion activities, such as straightening and bending. So this is patella mobilizations is typically something you want to do early on after surgery, so within the first week or two. And it's basically, the idea is you're loosening up the kneecap and making sure that it's moving freely with different motions. So let me show you some ways that you can self-mobilize your kneecap. So I like to do it in this position with my knee so sitting in a chair, and then just have my leg out in front of me. So basically just putting my heel out in front of me a little bit. The idea is you want to be in a very relaxed position. You don't want your quadricep tendons contracting and tight, because that's going to limit the motion that you'll be able to achieve. Other people like to do it in a lying down position, or what we call long sit, so sitting up with your legs out straight. And those positions can be beneficial too. What I encourage people to do is make sure you have a little bit of a flexion or a little bit of bend in your knee. So sometimes I'll encourage them to put just a small towel or pillowcase right under the knee if they're doing it in the laying down or long sitting position. So a couple of the main motions you can do. So first, you can do side to side motions of the kneecap. And there's a couple of different ways to do it. This is how I like to do it, is just get on each side of it. And then you can do repeated motions one direction. So right now I'm going laterally or outward. And then you can do medially or inward. Or you can go back and forth. There's no real special number or amount. I just like to do typically a handful, or a minute or two worth. And then you can also go up and down. So superior towards the head. So I like to do it this way with kind of my palms. Other people might do it this way with just the thumbs underneath. And this is working on your extension or straightening. So as you extend the knee, your kneecap actually moves a little superior. So we're improving that motion and mobility. And then you can also do inferior as well, which is the motion the kneecap will do when you bend or flex the knee. And a lot of it is just playing around with the different motions, finding a position where you're able to be relaxed and comfortable and not contracting the muscles very much. All right. And then you can also do tilting, so kind of doing this position and pushing down on each side of the kneecap and doing almost this tilt as well. So those are just a simple, easy ways to self-mobilize your knee, your kneecap, your patella after knee replacement surgery. And again, this is a good way to improve the mobility of the kneecap and in turn potentially increase your knee range of motion, or at least increase the comfort and ease with doing different range of motion activities. Thank you.